Good morning. My name is Dr. Tommy L. Robinson, Jr., and I'm president of the American Speech-Language Hearing Association, commonly known as ASHA. I'm a speech-language pathologist working in Washington, D.C. ASHA is the professional, scientific, and credentialing association representing over 135,000 speech-language pathologists, audiologists, and speech, language, and hearing scientists in the United States. The outpatient Medicare cap on speech, physical, and occupational therapy services prevents patients from receiving necessary treatment. With a combined cap for speech and physical therapy services, patients are usually faced with the difficult task of choosing to either walk or talk. A patient in the United States should not have to make this choice. The caps interfere with regaining the basic ability to talk. Aphasia, a common result of a stroke, stems from damage to the parts of the brain that process language. Speech-language pathologists are skilled in evaluating and treating patients with aphasia. However, the caps rob patients of the opportunity to make sustained progress on the road to recovery. If you can't speak, how can you express yourself to family and friends? If you can't talk, how can you communicate with your healthcare professional? The therapy caps are also the most detrimental to the sickest Medicare patients. Speech-language pathologists play an important role in the evaluation and treatment of patients with swallowing and feeding disorders, otherwise known as dysphagia. Dysphagia is commonly found in patients with conditions such as Parkinson's disease, ALS, and multiple sclerosis. Dysphagia is most prevalent in stroke patients. Up to 70% of all stroke patients have difficulty with swallowing and feeding. Without treatment, patients with dysphagia face the possibility of poor nutrition and dehydration. They are also at risk for pneumonia and chronic lung disease. These consequences lead to increased or extended hospitalizations and strain our current healthcare system. I would like to close with a story from one of our members. Her name is Karen, and she's a speech-language pathologist in Kansas. Karen works in a skilled nursing facility. Recently, she had to make the difficult decision to discharge a patient with swallowing difficulties because he had reached the cap for services. The patient had been making progress. However, without additional insurance and no other method to pay for his treatment, he had to end treatment without the ability to eat solid foods. Stories like this are becoming far too common. ASHA urges Congress to work in a bipartisan manner to find a permanent solution to the Medicare therapy caps. Last evening, the Senate passed a 3-week extension of the exceptions process. We thank the Senate, but we hope that in 3 weeks we are not back here fighting the same thing. It's time to make this a permanent change. Thank you.